Hi, my name is Danese Rexroad, and I'm one of the nurse practitioners at Ways2Well.
Your treatments have helped me tremendously.
But all of my friends have been getting injured recently, and I've been pushing them all to come here.
They literally saved me. My quality of life is completely different.
Oh my God, the machine! Shout out to Ways2Well, testosterone's doing good.
Today we are answering some of the questions from the Ask Me Anything that you guys posted. One of the first questions that we got was, have you guys treated anyone with chronic issues from COVID and what was helpful? So the simple answer is yes. The complicated answer is that every person's symptoms are very different. So if you're looking at chronic fatigue versus gut issues versus joint pain, it completely depends on your symptoms. I always recommend getting a comprehensive look at your blood work. Also, one of the things that I found to be very helpful is the methyl detox profile. So that's looking at your genes, specifically the MTHFR gene mutation that most people know about. This helps identify any broken pathways and items that you may be missing. If we take a deep dive in your blood work and look at any deficiencies, whether it's micronutrients or even antioxidants that your body needs, that can make a big impact. One of the other things I like to use is my peptides. And again, it completely depends on your symptoms. So if you want to take a deep dive into what's going on and how we can help, give us a call or reach out on our website, ways2well.com, and select Get Started. One of the next questions I was asked is hydrogen water real? Absolutely. One of my favorite water filters and water devices is the Kangen water filter. I also like the Berkey if you're looking at filtering water, but to put the hydrogen back in, the Kangen water filter is my favorite. One of the other questions that I was asked is thoughts on folic acid. Well, folic acid is actually a toxin. What we're looking for is folate. If you have a genetic discrepancy that does not allow you to methylate your folate, you could need specialized vitamins, specifically methylated vitamins. So folic acid itself is not what we're aiming for. We're looking for methylfolate, and that is a B vitamin that helps with energy, neuroplasticity in your brain, nerve health. It has a lot of other benefits to your immune system. It's really, really, really important. So one of the ways that we check that is looking at your B12, but one of the ways that we check the genetic aspect of it is through the methyl detox profile. Another question I was just asked is, how do I get blood work orders for existing patients? That's easy. Just send us a message in the portal and we'll get your labs ordered. Whether or not you need a full follow-up panel or a comprehensive panel, just let us know and we'll get that ordered for you and taken care of right away. So one of the other questions I received in the notice is, do you only prescribe hormones based on symptoms or lab results? Well, one of the things that we do very different at Ways2Well is we fully believe in symptom resolution. So when you're looking at the wide variety of normal labs versus optimal, we actually compare that difference and absolutely include your symptoms in any part of our diagnostic or recommendation treatment plan. So if you're symptomatic and the labs are just a little bit wonky, we're still likely going to treat you depending on what you need, and again, depending on the symptoms. We don't just look at your hormones, we're also looking at your B vitamins, your magnesium, your cholesterol levels. Cholesterol is actually a hormone, by the way. We also check your insulin, that's very important. We talk about sleep, we talk about diet, we talk about exercise and activity, we talk about stress management. So all of those factors are a huge part of health optimization. So treating hormones is a part of it. We call it holistic care, W-H-O-L-E, so we're looking at the whole person and not just your hormones. Another question I got is, will my insurance cover my prescriptions? Well, the simple answer is likely not, because insurance doesn't necessarily cover something unless you're in the sick care system. So in some cases, some of the medications can be covered, but it's completely dependent on your insurance policy. Since we're not an insurance provider, we can't always provide the codes that your insurance is looking for to get everything covered. But we are partnered with Revive RX Pharmacy, and that's a compounding pharmacy, and they keep their prices very comparable to paying a copay on your insurance. If you want to find out why we are cash pay, check out our pinned post. One of the other questions I received in the Ask Me Anything is a really tough one. It is specifically asking about EBV after COVID. EBV is Epstein-Barr virus, and it's a very powerful virus that stays dormant in your system for a very long time. It has very severe side effects. The fatigue is overwhelming. One of the things I like to do is get to the nitty-gritty of your immune system. We talk about sleep, your circadian rhythm, the supplements you're taking. Nutrition is everything. What you put in your body will help determine how you heal. I say this with everything. We are a holistic care, whole person. There are many aspects of contributing factors that would help your immune system and help you recover. I also like to use my peptides. I have quite a few that I pair in as needed, but we do a layered approach to health optimization, especially in cases like this. I would love to help you. Reach out to us on our website and select Get Started, and just let us know that you're the one that asked that question, and we'll get you taken care of. Where do I inject my BPC? So it really doesn't matter what injury you have. Some people say to inject it right on the site. I'm not a big fan of that because we inject every single day, and I just think it creates more tissue trauma. BPC itself can be injected subcutaneously, and my favorite location is right here in the belly fat. So make sure you select your spot, clean with a little alcohol. I rest my wrist on and just stab it in like a dart, or you can also do it in your hip on the side. You can do it in the top of your arm here. You don't have to inject it right in the area that it's injured. Some people still choose to do their thigh or very close to the area that is injured. I just exercise caution because you're going to be injecting every single day. So the repeated injections may be a little tender over time. So you can alternate locations in your belly to your hip, or you can start right hip, right belly, left hip, and rotate around every day. That way it's a little less tender.